Good morning. I want to speak about water, sodium, which is very important for our health, for our blood pressure. Sodium is very important for the health of the nervous system and especially the nerves. The nerves will supply the heart muscle to contract as well as the skeletal muscle to do our exercises and movement, and also the smooth muscle in the gut and the internal organ in the abdomen. So suppose the sodium is less in the blood, or the water is less because of too much urination, or too much sweating or perspiration, or the loss of water from the cells into the environment around the cells. So this will trigger the kidneys to produce an enzyme which is called renin. And this renin will go in the blood to the liver, and the liver will produce hormone, which is a protein. It is called angiotensinogen. Angio means it works on the blood vessel. Angio, it is in Latin blood vessel. Tensino means it will contract the blood vessel. Ogene, it means it is not active. It is pre-active. It doesn't do any work. So the renin will come to the liver and cut the angiotensinogen into two parts. Part 1, leave it, forget about it, and part 2, which is called angiotensin number 1. Angio also, it means in Latin blood vessel, and tensin means contraction of blood vessel. This angiotensin 1 doesn't do any work. So it go to the lung. See, it is a loop, like London loop for walking. And the body is just like a city, very complicated. So it go to the lung, and there is angiotensin converting enzyme, which we refer to as ACE. There is ACE1, ACE2, ACE2. This will change the angiotensin 1 into angiotensin 2. Okay. Angiotensin 2 will go in the blood and will go to the adrenal gland, which are above the kidneys. And the adrenal gland, the outer part of the adrenal gland, it is always divided into cortex, which is the shell, and the inside, which is called medulla. It is from the cortex or from the shell. It produces hormone, which is called aldosterone. Aldosterone, it go in the blood, it will go to the kidney because the problem started in the kidney, and it is logical because the kidney is responsible for secreting urine and for secreting salt or reabsorbing salt and reabsorbing water. The kidney is the regulator. So this will, aldosterone work on the kidney. It will reabsorb sodium, and wherever sodium go, the water stay with it, and the water. And why? This is all to raise the blood volume and to raise the blood pressure and to keep the circulation intact, because we have to keep the circulation and the blood pressure higher because it will distribute the blood to every cell in the body. This system or loop or axis, it is called RAS. R for renin, A for angiotensinogen, A for angiotensin 2, A for aldosterone, and S for sterone. Okay, so it is RAS, R-A-A-S. Good. And this is very important. Also, aldosterone, it not only work on the kidney, but it work on fat cells. It stimulates the formation of a new fat cells, and the old fat cell, it will stimulate it to divide. So this will lead to increase in the fat, the aldosterone. So this is one of the causes of dehydration and increase the dehydration. It is very important to think of this. Also, I would like to mention about insulin hormone. It works also on the kidney to absorb sodium and water. Why? Because insulin hormone, which is raised by eating sugar and refined carbohydrate, insulin is a growth hormone. And to stimulate the cell to get bigger, it needs water and it needs minerals and sodium. So this is very essential for insulin hormone to do the cell growth everywhere in the body and to make fat, to save energy, as well as it stimulates cells, the lining of the blood vessel, to block the blood vessel. It will stimulate the micro cancerous cells to make it bigger. This is very important to connect the RAS, aldosterone and fat, insulin. If we do fasting, then we will, the blood sugar will be less in the blood, the insulin hormone will be less, and the kidney will start to secrete water and sodium. And this is how we lose weight when we fast, to lose our weight, because we will lose a lot of water and we will start to urinate too much. Okay, if we fast and the blood sugar will be low and the insulin hormone will be low, we should take water to hydrate ourselves, as well as salt and electrolytes. And this is very important for those people who fast long fast, for example 3 days, 5 days, 7 days, or those people who do ketogenic diet, eating only fat and no sugar at all. It is very important to take water and salt. Okay, and I want also to connect it with COVID, because COVID, it works on the lungs, and the site of work is the receptor, which is called converting angiotensin enzyme. Angiotensinogen converting enzyme, ACE2 and ACE1. And these receptors, or the one which convert the angiotensin 1 into angiotensin 2, it's found in the epithelial lining of the lung, of the alveoli, as well as in the heart. That's why COVID affected the heart of some people. And also in the lining of the gut, GI tract, and so, especially the small intestine. And that's why some people, they show signs and symptoms of gastrointestinal disturbances. It also, they are found in the lining of the blood vessel. So COVID attack the blood vessels and cause the inflammation in the lining of the blood vessel, clotting, stroke, and so much. So it is very important to understand the pathology. And the antihypertensive drug, which they give us to reduce the blood pressure, it works on ACE2, on the angiotensin converting enzyme, to prevent the conversion of angiotensin 1 into angiotensin 2, because angiotensin 2 is very active and to work on adrenal gland to produce aldosterone hormone. Also, they give drug which stop the function of angiotensin 2 by blocking the receptors where angiotensin 2 is working. I hope it is clear. I try to make it simple, just to understand the complexity of our biology and how we should respect our body and how we should reduce sugar and insulin hormone. Thank you and goodbye.